Extracorporeal Membrane Oxygenator, or ECMO, is something which is considered as a pinnacle in your life support in critically ill patients. A lot of intensivists across the world are trained into giving ECMO therapy. A lot of them actually are striving hard to become ECMO specialists. And this is certainly a branch which has revolutionized, I would say, not since COVID-19, but actually since the swine flu pandemic, especially the venous ECMO, which is used predominantly for respiratory support. And there is also a veno-arterial ECMO called as VA ECMO, which is used for a cardiac support. What is the basic difference? The basic difference is that in a VV ECMO or a venous ECMO, which is used for your lung support, when you have a problem with your lungs like ARDS or like bleeding in the lungs, something which is impeding your oxygen absorption capacity and something which is allowing you to have a type 1 or type 2 respiratory failure, you could use VV ECMO. In that, your cannula is placed into one of the peripheral veins going into the inferior vena cava, often from the femoral vein. And you take out blood from the femoral vein. It goes through a pump, it goes through a membrane oxygenator, and then oxygen-enriched blood or oxygenated blood, as we would call it medically, along with carbon dioxide removed, is actually pushed back into the body as close to the heart as possible with the return cannula. So the return cannula is as close to the heart, the aspiration cannula is as away from the heart as possible. And this allows a better oxygenation till the lungs improve. So that's VV ECMO. What's VA ECMO? VA ECMO essentially still means that you take out your blood from the venous side, which is your femoral vein quite often. But here your cannula is as close to the heart as possible so that you remove maximum amount of blood which is going into your heart. It goes through the same pump and it goes through an oxygenator. And through the pump, it's pushed back into your arterial system. Now, where do you push it back? You either push it back in your inferior part of the aorta, which is a descending aorta, or you actually put it through the axillary conduit as close to the aortic arch as possible, thereby allowing oxygenated blood go directly into the aorta, which is your arterial system, and allowing the oxygenation to take place. But what is important here is that when you are aspirating, when you are sucking blood, when you are sort of aspirating blood through the right ventricle as close to the heart as possible, you are actually giving very little preload to the heart and thereby resting the heart, allowing the heart to actually improve. It could also be used as a bridge for a transplant. Both the modalities, VV ECMO can be used as a bridge for lung transplant, VA ECMO can be used for a heart transplant or heart-lung transplant. There are a lot of complications as well which one needs to know about these therapies. There are a number of trials now which have actually shown that there is an improved outcome provided you time your ECMO correctly. And especially in the VV ECMO, the timing seems to be important. VA ECMO often can be used as a bridge towards recovery or as a bridge towards transplant. So my friends, I think this is a therapy which is going to stay here. I think most intensivists will have to learn it, will have to be acquainted with it. So go on and get yourself trained to use ECMO properly.